We're going to begin this hour with the nationwide increase in COVID cases and hospitalization. The highly contagious BA.5 subvariant now accounts for about 78% of all COVID infections in this country. The CDC says we're averaging more than 120,000 cases a day, but since many people are testing at home, the actual number is probably much higher than that. We asked you to share your questions about this latest COVID threat. Dr. Celine Gounder is here to answer what you've sent to us. She's an epidemiologist and our contributor from KFF's Kaiser Health News, where she's editor-at-large. Good morning to you, Dr. Celine Gounder. Good to have you here. You know, the thing about people testing at home, the number has to be higher, because I could see people taking the test and say, I'm going to keep this to myself, this positive diagnosis, don't you think?
Well, it's not just that they're keeping it to themselves. There's actually no way for them to report those numbers, those test results to the local health department, to the CDC.
Yeah,
There's no
who do you
mechanism
call?
for that,
Yeah.
right? Exactly.
Who do you call? All right, so we're going to start with Sarah Elizabeth. She's on Instagram. Very good question, Sarah Elizabeth, because this is exactly what I was thinking. She asked this: if I had COVID in the last 3 months, will I have immunity against this variant?
So if you got COVID 3 months ago, it's very likely you had the BA.2 variant, which is an earlier variant. The BA.5 variant is so different from all the variants, all the Omicron variants that came before it. It's very unlikely you have much in the way of protection from that prior infection. I think big picture, you should be, if you're eligible, so people who are eligible for a second booster are people who are 50 and up or 12 and up and immunocompromised. You should go and get that second booster now.
So when did that B5 variant kick in then, if you had it 3 months ago? What if you had it, say, first week of June?
Yeah, so essentially in the last month or so, we've seen the rise of BA4, BA5. BA5 seems to be outrunning BA4, constituting about 3/4 of cases now.
Are we picking up on a question here from a viewer on Twitter? Is there at some point going to be a specific vaccine for BA.5 or kind of the all-purpose flower? Like, we're just going to cover them all with this one shot?
Very good question.
We want that.
Yeah, right. Moderna and Pfizer are both working on these updated combo vaccines that will include the original formulation as well as a BA.5 component. Those will not be available until probably late October, early November. So if you're eligible for a booster now, don't wait for that one. You'll still be able to get that one. In terms of these universal coronavirus vaccines, I think that's the holy grail, right? That would protect you against all the variants. We unfortunately are several years away from having something like that. We don't have an Operation Warp Speed to really marshal resources to get that done.
Now, you mentioned vaccines for people over 50. Federal health officials are reportedly considering opening up a second booster for younger, healthier people under 50. So for those who are at home saying, OK, I'm young, I'm healthy, I've been vaccinated, boosted, why would I need a second booster?
It's a very good question, and there's actually a lot of debate among scientists as to whether to open this up or not. So this is very contentious. I think they probably will open up to people under 50. Myself, I'm under 50. I am not going to get a second booster now.
How come?
I just don't think you need it based on the data. If you're young, you're healthy, you don't have underlying chronic medical conditions, you're not immunocompromised, you're not really seeing a benefit in terms of prevention of severe disease.
So would you wait for the one in the fall? Would that be your recommendation?
If you're under 50
yeah.
and healthy, not immunocompromised, I would say wait for the updated booster in the fall.
Okay.
That's valuable information.
Yeah, that's good info.
For all you under 50 people, yes. On Instagram, Kaylee says, what do we know about this variant and the severity for children?
So we don't know that much about BA.5 in children per se, but what I would say is I think a lot of people think COVID is harmless in kids. It is not harmless in kids.
It's not.
So kids between the ages of 6 months and 4 years, so that's the age group that just became eligible for vaccination, they've had 20,000, really over 20,000 hospitalizations from COVID during the pandemic. 200 or so have died. These are preventable tragedies. So parents really should get their children vaccinated as soon as possible.
Teddy got his first shot just a couple days ago.
How'd it go?
Teddy. It
How
went
old
really
is
well.
Teddy?
Teddy's 3. Teddy cries all the time. He got ice cream yesterday and then cried because I wouldn't give him a second ice cream in a different flavor right away.
Oh, bad, Dad.
But this is the amazing thing. Didn't cry when he got the COVID shot. Like, apparently he's immune to pain.
Wow.
It's a tough cookie.
Maybe he thought he was going to get ice cream.
Teddy knows he's doing the right thing, Tony.
He did get 2 lollipops, though, so that could have been the thing.
He works you anyway.
Yeah, he did.
Good.
Thank you, Dr. Celine Gounder. We appreciate it.